from a laboratory point of view, Dr. George Deng from my lab at Columbia has been really heavily vested in understanding the differences amongst the different PI3 kinase inhibitors and trying to answer the question, why is TGR-1202 different from idelalisib and duvelisib? And we know that the chemical structure of TGR-1202 is really very, very different from that seen for idela and duvelisib. And so George presented some very nice data at ASH demonstrating marked effects on protein translation, in particular MYC translation. And he can demonstrate that with TGR-1202, he can show complete turnoff of MYC protein within 6 hours of treatment with TGR. He's shown profound synergy with proteasome inhibitors, and most recently has generated some new theories about a complementary kinase that might be affected by TGR-1202, not affected by the other PI3 kinase inhibitors, that may help explain this block on protein translation. So he just submitted this paper now for publication, so hopefully in the next few months we'll actually see that come to press, and we'll be able to have a broader debate about the differences of these between these drugs. In terms of where it's going in the future, as you know, the UNITY studies that the sponsor has launched in CLL, and now we're launching one in diffuse large B-cell lymphoma. And my good friend and colleague, Dr. Pierluigi Zinzani, is going to be the ex-US PI for UNITY DLBCL, and I'll be the North American PI. And that study is going to compare, it'll be a two-arm comparison looking at TGR-1202 versus TGR-1202 plus Ublituximab in patients with very heavily treated diffuse large B-cell lymphoma. So we see this as a natural evolution for the drug, albeit relatively small numbers of patients. The signal in diffuse large B-cell lymphoma is hard to ignore in the context of what's been shown historically with the other agents, and we think that this study will hopefully open the doors for a new class of agents that we can use in large cell lymphoma. And I think it should be very complementary to what Dr. Deng and others at the Center for Lymphoid Malignancies are doing at Columbia in terms of trying to better understand how these drugs might work in large cell lymphoma and how they might target very important oncogenes that drive lymphomagenesis in diffuse large B-cell lymphoma.